This is Dr. Nathan Radcliffe presenting a Zen 45 gel stent placed using an ab externo technique. I'm going to begin the surgery by making a subconjunctival dissection. Most importantly, I will be disrupting the insertion of tenons a millimeter or 2 millimeters behind the limbus. This will prevent tenons from ensnaring the gel stent and should allow good posterior flow. I've made a conjunctival pocket. I will place mitomycin-soaked sponges. I think the sponges here are a better idea than injecting, which I've done for years, but the sponges placed directly on the sclera should be well suited to stop fibrosis in the area that matters. You can see here tenon's fascia, which will be reapproximated directly to the limbus to stay out of the way of the stent. I'm using some BSS to perform hydrodissection to encourage large bleb formation. And here we have the standard ab interno Zen injection system. I'm going about 2 or 3 millimeters behind the limbus, and I am entering into the anterior chamber, being very thoughtful to, in this phakic eye with a shallow anterior chamber, to make sure that I get close to the iris, not embedded in the iris, and of course far enough away from the cornea where I won't have to worry about corneal decompensation. I have a nice placement. You can see about 1.5 millimeters into the anterior chamber. I can directly adjust the Zen. Here I'm using the Fechner forceps to grab the stent and manipulate it as I need it. I will now close the surgery with 2 interrupted tenonylon wing sutures, and again I'm making sure to get a little piece of tenons there so that I can have the closure that I want. Again, the flow is being directed posteriorly here. I'm not too worried about having a limbal bleb leak. It's possible. I am closing with 2 stitches though, and I think we'll have a watertight closure. We will have bleb formation on the table. Notice that I didn't need to make any corneal incisions whatsoever. Now you could have made a paracentesis incision to rehydrate the eye or reform the anterior chamber, but I've found that that's not necessary. The chamber is formed enough, the Zen provides enough internal resistance. I'll give an injection of an antibiotic and a steroid here to finish the surgery, and that is the ab externo Zen 45 gel stent placement.